you can have an acute injury to the rotator cuff muscles, and without repair, that can lead to abnormal movement within the glenoid fossa, where the arm bone moves abnormally and you develop arthritis. Alternatively, you can be an older person who has lots of arthritis, and because your arm bone doesn't move properly in the glenoid, you can develop rotator cuff tears because the muscles aren't strong enough to move the arm bone in the glenoid. So let's talk about the different levels of tears and dysfunction. But before I do that, there are four main rotator cuff muscles. One is called the supraspinatus, the other the infraspinatus, then subscapularis and teres minor. And they are torn generally in that order. The supraspinatus is the most important rotator cuff muscle. It is the meat between the bone sandwich, between the head of the humerus and the acromion above. And if that muscle is not present, then the head of the humerus moves up and you develop premature arthritis.
So let me tell you a story about one of my golfing buddies, Al. Al came to see me because he had severe lower back pain with pain radiating into his left leg. He wasn't able to play golf and he was considering surgery for his lower back. I talked to Al, I looked at his MRI, and I said, Al, you don't need to undergo surgery. I can get this better for you. We did a platelet-rich plasma procedure to his lumbar spine, and 6 weeks later, Al was back to playing competitive golf, and he won the senior championship at his country club. Al was so happy with the procedure that he underwent with me, and was so happy that he never had the surgery. So are you a golfer, and are you looking to avoid surgery? Do you want to continue to play competitive golf? Come to see us at Regenexx Pittsburgh, where we have non-operative solutions to help get you back in the game.
The degrees of tears can be anything from mild tears to moderate partial thickness tears, meaning that the tear doesn't go through the whole muscle and that some of the rotator cuff muscle is hanging on and connected to the muscle belly. Then you have small full thickness tears where there's actually a separation of the muscle, there's a disconnect, and there are small full thickness tears and large full thickness tears. When the tear becomes larger over the course of time, and it generally will if it's a full thickness tear, then there can be what's called retraction, which means that the muscle belly starts to separate from the attachment on the head of the humerus. There develops a big gap, and ultimately there's fatty infiltrate and rotator cuff muscle dysfunction. Moderate-sized partial thickness tears generally require some help. An important thing to understand is that we just don't stick a needle in the tear. You have to understand why the rotator cuff is torn in the first place. If it's a degenerative tear that's occurred over the course of time, we're going to treat the joints, usually with bone marrow aspirate, to help the process of changing the internal environment from one of breaking down to one of rebuilding. And also, we're going to treat the ligaments to stabilize the shoulder. So we'll tighten the ligaments to help stabilize the humeral bone in the glenoid fossa. So it's a comprehensive treatment. If the tear is acute and you don't have a whole lot of arthritis and it's not a full thickness tear, then it's likely that platelet-rich plasma, which we get from the blood in your arm and put it back after we've spun it down, getting your platelets, concentrating them appropriately, and putting them in your rotator cuff tear. But we'll also inject your glenohumeral joint and inject your ligaments, as we recognize that it's a full functioning unit Instability in acute tears is likely what's caused the tear in the first place. So your ligaments didn't do the job they were supposed to do, and therefore the muscle has broken down. Bone marrow aspirate is for moderate to severe tears and moderate to severe glenohumeral and acromioclavicular osteoarthritis. These are the shoulder bones, mild osteoarthritis, and mild to moderate tears that are partial thickness in the rotator cuff require platelet-rich plasma, which is a much easier process to go through. So with orthobiologics, we expect recovery at about 3 months. I think that with a large rotator cuff shoulder surgery, you're looking at 6 to 9 months and sometimes even a year after the procedure to try and get back to full function. We regenerative interventional orthopedic doctors try to look at patients more holistically, understanding that the spine bone is connected to the shoulder bone, and if you don't have a healthy spine, it's going to be a more challenging recovery.